Gentlemen, I want to introduce to you Bill Lynch. Bill Lynch is probably one of the smartest guys I've ever met. Bill's been a clinical pharmacist for 36 years. He and I both have the same hairdresser, as you can tell. He works at the Jefferson Health Systems. Now, he's a very diverse man. He's also an adjunct faculty with Rowan University. He's the clinical preceptor at Rutgers University. He's one of our speakers at the National Marijuana Initiative. He is also our intern preceptor for our interns at the NMI. You know, Bill's position at Jefferson, he works in the ER/ED area, and he is seeing on a daily basis the issues in public health and actually in public safety that we're seeing with today's marijuana and cannabis products. So with that, he brought us a presentation today, Marijuana's Drug Interactions. It's the unknown and hidden dangers. Bill, I'm going to unleash you and turn you loose on the audience, buddy.
Good morning, everyone. Thank you, Dale, for that introduction. I'm going to bring up those slides. You can see them now for the presentation. So thank you, Dale, for the introduction. And we want to mention that I do not have any financial relationships to relate to the subject matter that I'll be describing today for you. And also the opinions are mine and mine alone and not any of the affiliations or organizations that actually Dale had mentioned in the introduction and that were listed on my first slide. If you think this is a great presentation, it's not without any help. There's significant contributions from all these people listed here on the slides. These are prior students who we've had with regards to the HIDA NMI program and other students I've had during the course of my time as a preceptor. And then these are specifically all of the interns that we've had through the HIDA NMI pharmacy internship program, and in particular, Alyssa Jang and also Jeanette Ijaz and Beth Ann Brandstetter were three of their most recent students who have significantly contributed, along with all these others, to this presentation about drug interactions with cannabis. So drug interactions, it's a pharmacist thing. But why is it so important is because it's also an everybody thing. So what that is, it's estimated now conservatively that about 50% of all Americans are taking some type of medication. And that's significant with regards to interactions of any kind, but in particular, if they're beginning to use marijuana or cannabis or CBD and THC, the impact that can actually have. So one of those places you can actually go to look at this yourselves as some of the general public is actually drugs.com. And what it summarizes here is that marijuana, including THC and CBD products, have hundreds of drug interactions of various medications. And you'll see here on this slide, THC at 96 and CBD at 61. That's not 96 drugs and 61 drugs. That's 96 classes of drugs and 61 classes of drugs for CBD. So in that 96 for THC or 61 for CBD are the statins, which are things that lower cholesterol. That accounts for about 10 different drugs, but that's only one of the numbers in these actual here. So again, hundreds of drugs that interact with marijuana. Why is this so important? Because now there's some recent data here from October of 2022 that our older Americans, increasingly deadly combinations where deaths are skyrocketing among the senior citizens 65 and older because of drug interactions that are occurring just in general, and in particular with certain medications. This is a recently published paper that came out this year in the Journal of American Geriatric Society, looking at emergency department visits for our Western Summer colleagues out there. Good morning, from there in California from 2005 to 2019. And what did they actually see? You can see here from 2005, really about 25 per 100,000 ED visits were related to cannabis, and now it's almost over 400 out to 2019, a significant traumatic increase in the number of individuals who are 65 and older coming to emergency rooms in California because of a cannabis-related situation. And this shows you here with regards to all of those numbers. We're going to focus primarily on this here in the middle gray, where it's the Carlson Comorbidity Index score. And that's actually showing how sick are senior citizens, what other disease states or complications do they have? Do they have diabetes? Do they have heart disease? Do they have chronic obstructive pulmonary disease? What are those things? Well, if they have no Carlson Comorbidity scores, they don't have any of those diseases, and shows you that the relative percent increase was over 2,300%. However, those who are a significant number of senior citizens who have more than 3 or more comorbidities, they only went up less than 1,500%. So a significant increase that was seen was surprisingly, and although counterintuitive, in our healthiest seniors are the ones who are using marijuana and coming to the emergency room, the greatest percentage increase because of the fact that their usage, and I think that it's viewed to be quote unquote safe. And the problem with that is it's not safe and it can cause all kinds of problems. The key takeaways from this particular article were that increased relative rates in older adults without these comorbidities are the ones that are having the biggest problem, and that a lot of this is being driven by their aging, most importantly in this presentation, their medication use, and most importantly, drug interactions, and their coexisting health conditions. And what's important now is that all older adults, and it doesn't say seniors, all older adults should be screened for cannabis use and educated about its adverse effects. And as a practicing pharmacist, we should tell you that all patients should be screened for cannabis use and educated on their adverse effects, irrespective of their age. So there's key definitions. I thought you would think that THC is tetrahydrocannabinol. It's actually terrible health consequences, which we're going to talk about with regards to drug interactions that occur. And also that Dr. Roller alluded to this about CBD, cannabinol is the nickname I give it, is that most people think that CBD is benign. And au contraire, on the contrary, it is far from benign. And we'll show you that with just the drug interactions that occur with these two particular compounds. So most importantly, enzyme inhibitors. If you inhibit an enzyme, that enzyme goes down, but the drug level goes up. And when that happens, that can actually make that drug toxic. And that's just important to know these inverse proportions. So if you inhibit an enzyme, the drug level goes up. What's important is that it competes for that particular enzyme, these drugs, and it affects the results, making them ineffective, the medication. And if it's a strong inhibitor, you may actually increase the A under the curve, AUC 5-fold, because you'll decrease the clearance of that drug by more than 80%. That's significant. And medications being cleared and now is reduced by over 80%. You accumulate that drug significantly and get toxic effects. Moderate inhibitors are about a 50 to 80% decrease, but a 2 to 5-fold increase. And then weak inhibitors about a less than 2-fold increase. So with enzyme inducers, that's right, induce the enzyme, that actually raises the enzyme levels, and then that therefore decreases the drug levels. So once again, that inverse proportion of induced enzymes decrease drug levels when that should occur. And the key here is that strong inducers cause an 80% reduction in the drug. So now if you need the medication to be effective and at the level that you're taking it at, and I've reduced that by 80% because of a drug interaction, it's going to become ineffective. And now they're going to have issues with regards to their disease state that's trying to control. And then moderate users, there are 50 to 80%, and weak inducers are less than a 50% reduction. And here's what that shows you just with regards to morphine. The gray line here is that Cmax is here at the top with regards to, that's the maximum concentration. The Cmin on the far right there, highlighted in yellow, is the minimum concentration. You'd have to redose the drug there at 3 hours. And then AUC is the area under the curve, which is all that shaded area that would be under that solid gray line, which is how much exposure you get to morphine at the time that's exposed when someone should take that medication, irrespective of the drug interaction. So what about pharmacokinetics and pharmacodynamics? Pharmacokinetics are what the body does to the drug. The body absorbs it, the body eliminates it, the body metabolizes it, the body distributes it to key organs where it should work. And then pharmacodynamics are what the drug does to the body. So what does that drug do? It lowers your blood pressure. It helps you breathe. It actually is an anticoagulant. So you don't throw a clot if you have atrial fibrillation and have a stroke. Those kind of things, and they're the difference between PK and PD. So this looks at the pharmacokinetics, onset of action, bioavailability, half-life, how long does it take with regards to cannabis if it's actually used. And it's from the monograph from Lexicomp that we use. And it shows you here that onset of action is about 5 minutes if you inhale cannabis, but it takes 30 to 90 minutes if you should actually swallow it and it goes into your stomach. But if you take it sublingually, like a CBD tincture, and put it under your tongue, it only takes 5 to 30 minutes because that bypasses what's called first pass effect, where the liver metabolizes something quickly if you actually take it orally, but doesn't go to the liver first if you take it sublingually. And we use that sometimes to our advantage in dosing medications like sublingual nitroglycerin to relieve someone's chest pain. It shows you the duration of action. If you inhale, it's 2 to 3 hours, 4 to 12 if you use orally, and sublingual is 12 to 24 hours. But all different kinds of pharmacokinetic parameters to this, which is important because of the fact that it differs also by the way that cannabis is consumed. And whether you inhale it or take it orally or sublingually, all those have impacts on the pharmacokinetics of the substance. It also shows you here that metabolism is by these key isoenzymes we talked about, 2C9, 2C19, 2D6, 3A4. All of those are enzymes that are affected by cannabis, and that is important with regards to these drug interactions and their impact on THC and CBD, and then THC and CBD's drug interactions on different medication that we're going to talk about. And what's important here is it shows you excretion is also urine and feces, and that's important in the fact that urine is the kidneys are involved, and feces with regards to matter that's actually showing it's metabolized by the liver. So with regards to excretion of cannabis, it's involving with the kidneys and the liver, which is important because many drugs are all affected by with regards to urine and the liver and by feces. So you'll either have kidney involvement or liver involvement, and that can be affected by cannabis being used. The other issue is that there's food interaction. So the AUC is actually increased fourfold if someone takes CBD with a high fat meal. So this is someone who actually decides to consume oral CBD and they actually decide to have it with a nice heavy peanut butter and jelly sandwich. With that peanut butter, if it's high fat, will actually increase the absorption of CBD just from a food interaction fourfold would normally have been if they didn't have any high fat intake when they consume the CBD. The other one that people don't really know about is there's significant allergic reactions with regards to cannabis. So what's important is, are people predisposed to these allergic reactions? And they may be based on the fact that they have certain type of plant-derived food allergies, which are usually fruit or vegetables. So people who actually have allergies to peaches and or bananas and or apples and or cherries and or nuts and or tomatoes and or oranges and or grapefruit are potentially prone to having allergic reactions to cannabis. And that's because of the fact that cannabis is grown and so are these fruits and vegetables, and there's a potential cross-sensitivity. This is similar to people who may have an allergic reaction cross-sensitivity to cephalosporins because they have a penicillin allergy. We ask that all the time, and that's important to note in that these food allergies may cause that type of allergic reaction with marijuana as well. So searching for drug interactions. Us healthcare professionals, we will go to Lexicomp or Micromedics to do that. You could go out to drugs.com. And the way we do that is go to drugs.com and look at their drug interaction checker. And where it says enter a drug name, you can type in this case, cannabis for marijuana. And you would also, let's say, because you're on warfarin, Coumadin, you could type that in and see, since I'm taking warfarin now for my atrial fibrillation, because my doctor doesn't want me to have a clot or have a heart valve and doesn't want me to have a clot and have a stroke, I'm taking warfarin, but I'm going to consider using cannabis as well. And when you put those in there, it gives you there in the middle, unsaved interaction list, cannabis and warfarin. And then you hit the blue box to check the interactions and what would come up. What you'll see is there's 3 potential interactions with cannabis and warfarin, and the consumer information there with regards to interaction shows you this, that smoking marijuana may increase the blood levels and effects of warfarin or Coumadin, which means you have the propensity to bleed. And that's significant. And if you wanted to find out further information, you could switch to the bottom there. It says switch to professional information, and you would get this kind of information, which is much in depth and shows you once again that the inhibition of these enzymes, 2C9, 2C19, and 3A4 metabolism are what's going to impact marijuana and also is going to impact the issue with warfarin. They're also cited, so depending upon if you want to go to references, you could verify that as well. But this shows you specifically what one of those interactions are. And importantly, it shows you that with regards to a patient with a mechanical heart valve, that they had 2 episodes of increased INR bleeding when they came in about 3 weeks apart. Person stable in their medication for 6 months. However, they start using marijuana for 4 weeks due to depression, and then they came in 2 times 3 weeks apart with significant bleeds where they had to be hospitalized because their INR was elevated. And when they stopped using the marijuana, didn't experience any significant bleeding complications, that interaction resolved. What's important is this also happens with CBD and or THC. So there's both of those components of the marijuana plant that can actually cause warfarin drug interactions to have a supratherapeutic, meaning elevated INR, and that is what is causing these patients, unfortunately, to bleed. What's also important here is that this shows you warfarin, but now these healthcare professionals are considering, well, we're going to use some alternative medications. So what about clopidogrel, Plavix? What about using that to actually has an anti-clot? Because this here shows with regards to delta-9 THC, there's no drug interaction with delta-9 THC and clopidogrel or Plavix. However, with CBD, there's a significant interaction, and the inhibition of the CYP2C19 enzyme actually decreases Plavix or clopidogrel levels because it decreases the active metabolite of clopidogrel, and that can cause the person to actually clot. So now the Plavix would not work as an anticoagulant and actually cause them problems. And with regards to just taking a proton pump inhibitor for severe gastric acid secretion or GERD, that inhibition as well increases omeprazole levels, and now, as we told you, as it's cleared through the liver as well, that could potentially cause hepatotoxicity. So significant warnings there with CBD for both Plavix and Prilosec or omeprazole. With regards to that, monitor patients closely for diminished response to the clopidogrel, because if they're not working, you may have to increase the dose. That's possible with regards to clopidogrel. And the other one is actually stop CBD to prevent that interaction from happening. What about Delta 9 now with Briviac? That's actually medication that we use in anticonvulsant for seizures. The seizures of moderate interaction with Delta 9 and also with Soma compound there, which is a muscle relaxant. It also shows you here that with CBD, there's also an interaction with Briviac along with the THC component, where here you get additive CNS depressant effects that then lead to enhanced sedative, psychomotor, and respiratory effects, which are important in these patients, especially if they're using it for seizures. And if they're sedated, you're worried about the fact that they actually have a seizure, they're coming out of a seizure, their psychomotor effects, those kind of things. Is that truly from their seizure disorder or this actual interaction with the medication? And here what's important is to monitor those patients taking Briviac, because those combinations have a moderate CYP2C19 inhibitor again, and then you may have to further reduce the dose of actually Briviac when you give it to patients because of the CBD interaction. This then looks at, what about citalopram? That's a medication we use, a selective serotonin reuptake inhibitor for treating patients for sedation. And that may have an additive CNS effect, again, with these enhanced psychomotor, respiratory, and sedative effects, along with similar issues with clobazam, which is a medication that we also use to treat seizures. And what's important here is that with CBD, there's also a component of the interaction with citalopram. And here what's important is not only is it serotonin syndrome, which can be pretty traumatic, but also QT prolongation. And that's actually when your heart beats, lub-dub, that's the interval there, QTC. And what happens is when that prolongates, the prior T wave from the previous heartbeat overlaps the P wave for your next heartbeat. And when that happens, you can have sudden cardiac death by going to sudden cardiac arrest through QT prolongation. And that can happen with individuals who are taking just Celexa or citalopram for the depression. Now they start CBD unbeknownst to everyone, and all of a sudden start having chest pain or issues or start coming in. And we notice that their QT prolongation is more than 500 milliseconds. That's a red flag to us that something's going on. It can be caused by this drug interaction. What's important here is that looking at a study of pediatric patients, because clobazam and CBD are used together to control seizures sometimes in pediatric patients, it shows you here that 77% of them had to have a dose reduction in their clobazam. And that's because the increased levels of the N-desmethylclobazam, that's the active metabolite that works for this drug, the AUC was increased by 160%. And the Cmax by 120%, showing significant increases. And ironically, this increase looks like it led to increased incidence of pneumonia in these pediatric patients when clobazam and CBD were combined in multiple studies. What's important here is actually to monitor these patients again for clobazam side effects. You may have to give a dose reduction of the clobazam again. And most importantly, drowsiness, irritability, and ataxia disease, shakes and things of their muscles, which then again, is that actually a seizure or is that actually a side effect from this drug interaction, which can make it very difficult to discern what the actual cause is. So one of the most reliable places to go for any type of drug interaction for CBD is actually commercialized CBD, which is a pharmaceutical product called Epidiolex. And it shows you here there's a threefold increase in plasma concentrations, again, of N-desmethylclobazam, the active metabolite. And what's important here is that that should be followed closely. But if you're looking for drug interaction specifically with CBD, Epidiolex is a good package insert to go to and look these up as well. Citalopram is actually here with the CBD interaction, recommends considering therapy modification. That would either stopping the CBD or changing to a different medication instead of citalopram. And here the recommendation is that a max dose would be 20, which is actually a 50% dose reduction. It can be as high as 40 milligrams a day in patients with regards to that. Solistazole is actually another medication that's used as an anticoagulant. This is important because it also says consider therapy modification again. And the recommendation is to actually reduce, because of CBD being used, to a dose of 50 milligrams twice a day. That can be as high as 100 milligrams twice a day in patients because of the moderate inhibition from 2C19 yet again, and to monitor solistazole closely with regards to effects. So another question becomes is now you're actually a clinician or you're a patient and you have to consider, well, if I can't use warfarin, then what other medications can I use to actually as an anticoagulant? One of the most popular ones there is other anticoagulants, apixaban and known as Eliquis or Xarelto. They're called DOACs, direct oral anticoagulation therapy. But one of those medications can be considered because notice there's no interaction in green there with delta-9 THC. And we already talked about clopidogrel being an issue and also Pledol. So they're actually out of it with regards to that. But notice when you look at CBD and apixaban, there's now a moderate drug interaction that may be found. And that's a concern because now that's taken off the table. And when you look at that with regards to those different choices, it's important because now it would look at the fact that if I'm trying to pick a anticoagulant or a blood thinner for a patient, warfarin is out. These other anticoagulants, Eliquis and Xarelto, are out. The antiplatelet drugs are out. And now the only thing I have left is actually Lovenox, which is an oxyparin that's an injectable anticoagulant. It works great. But now you have a concern because the patient going to be compliant with injecting themselves every day with Lovenox as an anticoagulant? Or do you have to change therapy, or do you have to actually get them off the CBD, making the situation much more complicated? Now we're looking at, with regards to diazepam, Valium, that's a benzodiazepine, used for seizures and also anxiety disorder. And there's a moderate interaction there with delta-9, and also similar with now Lexapro, as citalopram also causes further problems. But the key here is that the inhibition of, once again, 2C19 of the metabolism of diazepam could cause that increased sedation and problems with regards to that. So what's important there is that, once again, Epidiolex telling us that there's significant interaction with clobazam and also with other drugs that could be CNS depressants like Valium, diazepam, but also include alcohol and other substances. And then most importantly, if actually is a diazepam interaction, is to monitor for the side effects from Valium, being somnolence and sedation. But what's important here is there are alternatives listed, so that we would know in the hospital we could use the razepam, which is Ativan, or oxazepam, which is Cirex, don't rely on these same metabolic pathways that diazepam does, and they could be alternative benzodiazepines that could be used to actually treat the patient. Escitalopram, again, with regards to the QTC prolongation, like citalopram, they're analogs of each other, again, limiting the dose to escitalopram to 10 milligrams a day, which is important. And then this looks at actually medication interactions with delta-9 THC, with regards to the fact that now you have medications that there's the flip side here. These medications may actually affect delta-9 THC or may affect CBD. So the reverse can be true from these medications also. So in this particular one, we're looking at the middle where it's fosphenytoin or phenytoin, which is Dilantin. Those medications are both used as an anticonvulsant for people who have a history of seizures, status epilepticus, those kind of things. What it shows you here is that the induction of 3A4 metabolism of delta-9 would lower THC levels. Well, if that happens and the person's using that for some reason, they're feeling less of an effect, they're going to naturally use more THC, smoke more marijuana, use more THC directly, vape more THC to actually get that effect. But here's the problem when they start doing that. There's a major interaction between the CBD component of cannabis and fosphenytoin and phenytoin. And that's important because it shows you here that now, because of CBD components inhibition of 2C19, that increases fosphenytoin and phenytoin levels. And why is that important? Because that can lead to severe reactions, including toxic epidermal necrolysis. And there you say SJS, which is Stevens-Johnson syndrome. That is where the skin starts sloughing off of patients, almost like a burn victim patient, because of the severe interaction with CBD and phenytoin or fosphenytoin when people should use that. And some have go to the hospital or hospitalized, and literally some require skin grafts to actually address the severity of the Stevens-Johnson syndrome. So with regards to this, monitor decreased CBD concentrations, which can also occur, but then also consider the need to make dose adjustments for the fosphenytoin or phenytoin when these are combined. And that's important, which we can actually measure phenytoin levels in the blood. 10 to 20 milligrams is a therapeutic area that's important. And if for some reason that there is an interaction, or that the level comes back too high, above 20, we would know we could actually reduce the phenytoin dose to address this as well. Other seizure medication, unfortunately, if we were considering what can we use for someone, there's things there with regards to Depakote, valproic acid, phenobarbital, carbamazepine, Tegretol. All of those interact and decrease the actual concentration of THC. As someone takes more of that, again, to increase side effects. There's also issues with the benzodiazepines there, which we talked about, diazepam directly, Valium, but also you can prolong CNS and respiratory depression with an interaction with the other benzodiazepines. So then looking at other medication for seizures, now there's moderate interactions with the CBD component, first here with the THC component, and now again with the CBD component. So both of those are factors, which is important if someone's using marijuana or cannabis, or if the individual decide to use just THC or just CBD, there can be problems with both. And then these are other drugs for seizures as well. This one shows you trileptal there, oxcarbazepam at the bottom. It's a strong 3A4 inducer. So once again, it would decrease the maximum concentration and the area under the curve of THC. So again, people would potentially overindulge in actually their THC component and use it because of the interaction with trileptal lowering the THC amount. This is a huge one here with regards to methadone. So now you have somebody who's on methadone maintenance for opiate use disorder, or they're taking methadone for pain management. And what ends up happening is they get an additive CNS depressant effect when CBD is used, because it inhibits, again, 2C9, which actually decreases the metabolism of the methadone. And now the methadone dose is actually higher. And so now someone's stable on this dose for the pain management, or they're stable on this dose for methadone maintenance, for medication-assisted therapy for their opiate use disorder. And now they have increased sedative and respiratory effects, because you're actually increasing the amount of methadone in the person's body because it's not being cleared like it was previously. This is important. It shows you here a significant interaction with regards to individuals who actually had a 13-year-old girl who took methadone twice a day and morphine for her cancer pain. But then because of that, she also increased using CBD. And you can see here the somnolence and fatigue and sleepiness that occurred. The methadone serum concentration was 271 and went down to 125 after a 54% decrease in the amount of CBD after she had stopped taking it 2 weeks later. So it's important here, again, where do you think the person has a methadone issue and it's actually an interaction with CBD. That shows us here with regards to a patient we've had for chronic pain management. Is this a methadone overdose? They're oversedated, they're unresponsive, their pupils are constricted and fixed. They don't respond to a substernal chest rub. When you try to wake them up, their oxygen saturation is below 90%. We give them naloxone. Unfortunately, they go through a full-blown withdrawal, but that's because they had started using marijuana on their own to treat depression, and that was actually having the methadone accumulate in their system to cause these problems. And that's why they came to the emergency room. What about medications being used for tacrolimus, which is actually for organ transplantation? These are people who've had liver transplants, kidney transplants, lung transplants. They go on these medications to not reject those organs. And it shows you here if they should start taking CBD on their own, or CBD is introduced to other medications they're taking, that this can increase significant side effects: hyperkalemia, their potassium goes up, hypersensitivity, allergic reactions to it, nephrotoxicity, damage to their kidneys. And actually, the American Society of Transplantation is on record recommending that no cannabis, marijuana, THC, or CBD products be used for anyone who is an organ transplant patient, especially when they're taking these anti-rejection drugs. The other one is valproic acid. That's actually used as an anticonvulsant, also for mood disorder. You can get elevated liver function tests from that. This shows you here the tacrolimus, again, a 3-fold increase in the serum concentrations from a 32-year-old woman who was taking it. With regards to her drug interaction after she'd been stable on it for quite some time, a 48-year-old woman having received tacrolimus again following a liver transplant, she had a similar situation where her levels increased to 17.2 from 7.7 with regards to the fact that she had engaged in CBD use. So again, we have to monitor for toxicity with CBD, causing it with this agent that's for maintaining their organ from an organ transplantation, and adjust the tacrolimus dose if we have to, should that occur. Valproic acid is huge. This is known for using for seizures as well. And if elevations in LFTs occur, the question becomes, is the valproic acid able to be continued? This is well documented again in the Epidiolex package insert, showing you that if elevations occur, discontinue or reduce Epidiolex. And a lot of times CBD and valproic acid are used in children concomitantly together to actually treat pediatric seizures. And what's important about the package insert, again, updated from October of this year, is that insufficient data are available to assess the risk of concomitant administration of other hepatic drugs, the use of those other hepatotoxic drugs to the liver, and CBD or Epidiolex, which is a very significant statement. Hepatocellular injury is well documented with regards to CBD. With regards to Epidiolex, it's recommended that individuals who have their transaminase levels, these are liver function tests, ALT, AST above 3 times the upper limit of normal, that's what ULN is, and also their bilirubin above 2 times upper limit of normal, that should be followed for patients. They should have that checked 1 month, 3 months, and 6 months after initiation. And if there's any addition or changes to medication, and surely anyone who's going to 7-Eleven or Wawa here in the East Coast to actually get CBD or a gas station isn't having their liver function test or bilirubin checked first to see if they really have a risk of having hepatocellular injury and what the baseline is before they actually start CBD treatment. Significant risk for hepatocellular injury. And in children who actually took this, they had elevated liver function tests more than 10% of the time. And those patients, and they, for the most part, except for their seizure disorder, were healthier young children. So what about valproic acid? Here's actually a person who was 4 times upper limit of normal after they began CBD with their valproic acid. They were taking it for a mood disorder. So the numbers that would be 50 to 125 were now 200 and more with regards to that. And here's someone who was taking it for a seizure disorder, who was away at college. Valproic acid was the only medication that worked to control her seizures for since she had them in high school, having been diagnosed with epilepsy. And she just disclosed she was starting to smoke cannabis because of stress and anxiety of being in college. And she had come in with regards to, and her liver function tests were 5 times the upper limit of normal, which was significantly elevated. What about antihypertensive? So now we're trying to control someone's blood pressure, and they're using marijuana, don't use marijuana. The problem here is, here's again why we said of the 96 drugs for THC, one of them was all the ACE inhibitors, which is enalapril, lisinopril, which people are familiar with regards to ramipril. Those drugs there are familiar with Vasotec or Pernavil, Zestrol, those type of drugs. What about clonidine, which is actually an alpha-2 that's actually used to decrease the blood pressure? These can all have complications with delta-9 THC. They can also have interactions with the CBD component. So there's, again, an issue with both the THC and CBD component in marijuana for all of these antihypertensive medications to control someone's blood pressure. So again, the action is to monitor them, because you have to check for liver function tests yet again with the CBD interaction for ACE inhibitors. So that's a red flag with regards to individuals there. So now our concern is they're having some problems with tolerating their ACE inhibitor for their blood pressure when it's really a CBD interaction. Clonidine is similar in that during its use, they should monitor excessive or prolonged CNS and respiratory depression. Course and dose titration may be required, which clonidine is significant, ranging from 0.1 to 0.33 times a day. So it's a pretty big swing. And if you tune in on tomorrow, later in the afternoon, when we give the xylazine update, this is important with regards to a CBD interaction for clonidine, because clonidine is actually used to manage the withdrawal syndrome from xylazine. And now you can have a CBD interaction that causes problems with that. So significant with regards to the impact that delta-9 THC or CBD can have on all of these antihypertensive. That also holds up for these ARBs, which are Cozar and Benicar, Diovan, people are used to with regards to those. They affect the blood pressure and orthostasis, so they can change their blood pressure significantly with regards to this. Same way for alpha-1 antagonists, which are your minipress, prazosin, and terazosin, Hytrin, that are additive effects for blood pressure. So they get dizzy, they get lightheaded, they pass out, their blood pressure drops significantly. Because of that, they get tachycardic from it. All those things regards to delta-9. Similarly with this situation for beta blockers, calcium channel blockers, hydralazine, a different type of vasodilator, all of these antihypertensives are having some interaction with delta-9, THC, or CBD, and can cause a number of significant problems, and ruling out multiple classes of medications that have drug interactions with the THC and CBD component of cannabis. What about drugs for diabetes? Here's one where someone needs to go on pioglitazone, Actos. There's no interaction with delta-9, so they think that there's no problem, but now they start using marijuana, and because of the CBD component, they get the elevated liver function test. This is important because back in early 2000, we had an issue with a compound in the similar class, troglitazone, Rizulin, that had such severe liver function test elevation and liver damage that medication was pulled off the market. So the potential is there for this class of drugs to interact with CBD. What's good news here is that the metformin and linagliptin, sitagliptin, Januvia, Tradjenta, and some of the other drugs that people may use, Trulicity, that they seem to be okay with CBD and delta-9 THC, which is important because they would be alternatives for us to use in the diabetic patient population. Dyslipidemia, statins again, no interaction with delta-9 or niacin, which we also use to lower their cholesterol for niaspan. However, when you look at the CBD component, there's elevated liver function test potential again. And the concern there is that with statins especially, is the person having liver function test elevation, going to liver damage, causing them to have muscle issues, which we call rhabdomyolysis or rhabdo. And that shows you that here, a 67-year-old man who came in with 2 prior histories of heart attacks. He also had already had a coronary artery bypass graft done. He's on atorvastatin 80 milligrams orally every night to maintain his cholesterol and also to cardioprotect him from these events he's already had. He's stable on it for more than 6 years, and he issued taking CBD for depression because of the recent death of his spouse. And unfortunately, now his elevated liver function tests are 5 times upper limit of normal. And once again, is he developing rhabdo, which is our concern. Discontinued the CBD, his liver function test returned to baseline. He was given some other medication that did not interact with the other medication he was on for his depression. Fenofibrate, Tricor, also known to decrease lipids. No interaction with delta-9. However, elevated liver function tests again with CBD component. So again, a similar situation you could be concerned about with fenofibrate causing problems. What about now patients who are taking medication for their ADHD or ADD. So the stimulants, Adderall, Vyvanse are here. This is important because cannabinoid-mediated increased catecholamine concentration means it increases catecholamines, and these patients can have significant tachycardia in the delta-9 component. Or another stimulant that's used for ADD is methylphenidate, which is Ritalin Concerta, has a similar effect with regards to catecholamine concentrations being increased. This is important because it also is a factor with CBD, but with stimulants, not the amphetamine, dextroamphetamine type, but the one with methylphenidate, this one in particular also, the cannabinoids inhibit carboxyesterase 1, which actually does not then metabolize the methylphenidate, and they get increased methylphenidate levels and toxicities from that. So there's a double interaction here with the stimulant methylphenidate from a CBD and THC drug interaction that we show in these two charts. In particular to that, there's also this methylphenidate interaction, which we talked about. And what's important there is that after 7 days of co-administration, it showed that CBD predicted an increase in methylphenidate AUC and Cmax by literally 55% for the AUC and 45% for the Cmax, again, from this carboxylesterase 1 inhibitor that actually occurs, raising those methylphenidate levels and causing these toxicities, which are decreased appetite, headache, insomnia, the tachycardia, and the like. So here's a 17-year-old senior who actually stable in his methylphenidate, 27 milligrams for his ADHD for 10 years, comes into the emergency room with a heart rate above 160. We lower that with metoprolol IV, get him down below 90. He talks about he self-initiated CBD to deal with his anxiety in high school, applying to colleges and his AP classes. The CBD is discontinued, his anxiety is addressed. We use short-term metoprolol to lower that heart rate. And what's important here is that that actually worked. His heart rate's back in normal sinus, and he was able to finish high school and college as he goes away to college on his methylphenidate ER and in his junior in his university of his first choice, and he's doing well. But again, an interaction because of him starting his CBD on his own and the interaction he had with his methylphenidate. Here's a student who was with Vyvanse on 60 milligrams for his ADHD, stable for 12 years. He smokes marijuana, and because he's in a severely competitive high school program, he wants to be an automotive design engineer and gets caught with a pipe and has healthcare professionals talk to him about lowering his Vyvanse dose from 60 to 50 to 40 and stopping his marijuana use that he was using because of the anxiety and insomnia for trying to study for school. And with regards to that, what's interesting is that as younger pediatric patients become older, stimulants start to act like stimulants as they go through puberty. And now this was giving him the side effect of insomnia, which he hadn't had before because of the marijuana increasing his insomnia and also the drug interaction causing that to happen with his Vyvanse. That was actually decreased to 40 milligrams. He graduated high school and college, and fortunately is now an automotive design engineer. So all these things you can see significant drug interactions that can occur. This is a major one with regards to delta-9 THC and bupropion, Wellbutrin. This is a medication that's used for depression significantly. And what is important is there's a dose-related risk of seizures just with bupropion alone. So when bupropion is actually used, it's 150 milligrams up to 300 milligrams, and the maximum is 450 milligrams of bupropion a day. Once you get to the higher doses, you increase the risk for seizures just with bupropion. Well, the issue with delta-9 is that there's an interaction there as well. And it's important because extreme caution is to be used because of this seizure threshold, especially now in elderly or patients with a history of seizures who may be using bupropion for its medical use. And bupropion should be discontinued and not restarted in anyone who experiences a seizure during treatment. This is important because there's also bupropion, as in Zyban, is used just for having people stop smoking. And there's a dose-related risk with regards to seizures there as well. So now someone's using bupropion just to stop their smoking, and because of the fact they engage in using CBD or THC use, there's an interaction potentially there that can cause them to further increase the potential for a seizure, as in lowering the seizure threshold and making them more prone to having a seizure. So here's a 28-year-old male who's taken bupropion 450 milligrams XL once a day for depression. He needs CBD for his anxiety he also has. He's actually in recovery for opiate use disorder, and he has a motor vehicle crash where he states he blacked out driving to work. He had a seizure while driving. He's actually on probation, and he tests positive for THC on the urine drug screen, which Dr. Roller alluded to, is that you can test positive for THC just using CBD, and that's a parole violation for him. So now he's going to jail. It's discovered because he had some of the CBD formulations still available. He was taking that THC was actually in it, even though it wasn't supposed to be. And now you have the bupropion 450 milligrams and THC contributed to the seizure and the motor vehicle crash. He's not guilty for violating his parole. Different medication was now dosed for his depression, and he's still in recovery, working and doing well. But I had the unfortunate experience of having a seizure from this drug interaction with cannabis, using marijuana and also CBD, and then or using the CBD component with his bupropion, having a seizure while driving. What about gout? This is a big issue here, which is a pretty interesting medication. It's used to actually treat uric acid buildup and gout, painful in your joints when uric acid gets higher, and these medications help address that. No interaction with delta-9, but notice there is a huge major interaction with colchicine and CBD. That's because of this P-glycoprotein pump that's inhibited, and the serum concentrations of colchicine can go significantly higher, and there's a risk for further renal, kidney, and hepatic liver impairment. This is important because, as you notice in the red box, this information that's found is disparate. In Lexicomp, which we confirmed literally last night, this still shows up as a major drug interaction in the pharmaceutical or healthcare professional side that we look at. There's no interaction described in drugs.com. That's a big difference with regards to that. And what's important is if somebody already has kidney issues or liver issues, it really runs the risk of having them have fulminant impairment or failure if they should use colchicine and CBD. And that's a major, major issue. It shows you here the colchicine prescribing information tells you that on average in these studies, the increase in colchicine area under the curve was up 93 to 296% when it was used with other drugs that cause these problems. And also the serum concentration, the Cmax, increased 40 to 270%, showing the combination of P-glycoprotein and these ABCB1 inhibitors. With regards to renal and hepatic impairment, it is recommended by this do not use. This is a combination that should definitely be avoided. So if someone uses colchicine, CBD should not be used at all in these patients with regards to that. And what's further disturbing is when CBD or when colchicine was combined with a drug called clarithromycin, which is actually an antibiotic, that's actually a 3A4 inhibitor, the accumulation and increase in colchicine levels caused 10% fatalities in that group, a significant drug interaction from someone who just has gout, taking their colchicine, or comes in with an acute event, which we can dose up to 1.8 milligrams of colchicine instead of 0.6. And now because they're taking CBD and they don't admit to that, could cause significant drug interactions. Opioids, severe, moderate with regards to reactions as well. With delta-9, also with CBD, and most importantly here, again, that P-glycoprotein inhibitor pump increases concentrations of morphine, oral morphine, leading to hypotension, respiratory and CNS depression, profound sedation, coma, and even death. A major drug interaction between CBD and oral morphine. And in this particular case, looking at MS-Contin, which is sustained morphine, it's actually taken orally to manage patients' pain. The recommendation here for morphine and CBD is that they should be avoided. Caution recommended whenever morphine is used with a concomitant PGP inhibitor, in this case, CBD. Shows you here again, Cmax, AUC, and the Cmin for morphine. And then the dotted line there is morphine 6-glucuronide. That's the active metabolite of morphine that would work. And all of those run the risk of increasing their levels, their Cmax and their AUC, and that causes a significant somnolence and potential overdose and death from literally an opioid overdose that's actually induced from a drug interaction with CBD. Epidiolex warns again with regards to this about the P-glycoprotein substrates. Sirolimus and tacrolimus are those medications for organ transplant. Digoxin is actually used for heart failure. Major drug interaction again, and you can also throw oral morphine in the mix here. Tramadol is another one with a major interaction with delta-9 THC for increased risk for seizures. That's a medication that's used a lot of times for pain management in patients. Also inhalers, albuterol, now used with regards to cannabinoid-mediated increased catecholamine concentration again, and that leads to tachycardia. Anyone who uses an albuterol inhaler will tell you if they should use it, their heart starts to race. And that just documents that co-administration also occurs with cocaine, also being a catecholamine issue with regards to those medications being used, and that also monitor for the increased tachycardia. So anytime someone comes in with their heart racing, if they should use marijuana, usually 6 hours or less, could be a significant cardiac event as well, they should be coming to the hospital. So here's a patient, 22 years of age. My heart is racing and it won't stop. He's at home smoking marijuana. He has a history of asthma. He has a full-blown asthma attack. He takes albuterol and heroin multiple times. His heart's now racing because of that albuterol and marijuana and the drug interaction. He receives albuterol nebulizers in our emergency department, and then we actually have stopped that, and he goes into full-blown atrial fibrillation, fortunately with no rapid ventricular response, so it didn't go down to his ventricles. We have to give him diltiazem IV push, put him on a diltiazem drip to control his atrial fibrillation. He's converted to oral, and now he's a chronic atrial fibrillation patient at the age of 22 from the albuterol and cannabis drug interaction that occurred. With regards to, even though he did respond to diltiazem, there's also potential with diltiazem for tachycardia, and we had to weigh the risk benefit, but that actually worked to control his atrial fibrillation. Antibiotics, short term, use for an acute infection, no interaction with these: beta-lactams, augmentin, quinoline, Cipro, Levaquin, macrolides, azithromycin, your Z-Pak, Z-Max, no interaction with Delta-9. However, an interaction with CBD, again, all putting you at risk for elevated liver function tests. And now where someone's stable on medication and now they take an antibiotic acutely, it now impacts with regards to elevated liver function tests because of the CBD involvement. Other interactions: tetracycline, minocycline, nitrofurantoin for urinary tract infections, Bactrim for skin infections and also urinary tract infections, no interaction with Delta-9. Interactions with CBD, again, with risk for elevated liver function tests. Glaucoma, interesting, not recommended by the glaucoma societies to use marijuana to treat it because we have plenty of agents to do that. One of them is actually brimonidine tartrate. It's alpha-GAN eye drops. What most people don't realize is that medications taken into the eye has significant systemic absorption into your body. It's not as well protected because it's not going through skin, that kind of stuff, when it goes through the eye. And these alpha-2 agonists and CNS depressions make it potential for someone to have hypotension and orthostatic changes in their blood pressure. So they can actually have their blood pressure drop significantly when Delta-9 is used, THC, which they think they're actually taking for glaucoma, along with their alpha-GAN eye drops, and actually can cause significant problems with their blood pressure. And topically administered alpha-2 receptor agonists are systemically absorbed, which we mentioned, and the potential's there, producing rare but clinically significant systemic effects, again, with that blood pressure drop. These are all medications not to use disulfiram and abuse because there may be an alcohol component causing a disulfiram reaction in now using medications with THC. So all these medications here are major drug interactions and all should be avoided if anyone is using Delta-9. And cannabinol, au contraire, on the contrary, like we said, CBD is not a biologically inert compound. There are complex PK/PD profiles with regards to this. Medical CBD users under clinical supervision should be screened for potential drug-drug interactions and adverse drug experiences between the CBD, and they should have a liver function test started at baseline and monitored to make sure it's not causing a problem. Increased awareness needs to be among our general public who are using CBD recreationally or if they consider it to be used medically, and it should be managed significantly in these patients during those regimens, especially looking at all the other medications that they take. So as healthcare professionals, we teach this at the medical school and our pharmacy students all the time. It's important to ask these patients, do you use marijuana, cannabis, THC, or CBD? All four of them have to be asked. If you ask the person who's marijuana and they're only using CBD, they're not going to say they use marijuana. And then the question becomes, if they are using THC, do you use Delta-8, Delta-9, Delta-10, THCO, the oxalate, or some other form of THC, so that we know the potential is there for all these interactions we just described, and there are many more that we were not able to cover today. The other question is, what form of cannabis, marijuana, THC, or CBD do you use? Are you using a blunt joint implanter that you're actually smoking? Are you using a vaping cartridge? Do you use oils, concentrates, distillates, dabs, tinctures, edibles, topicals? Is it PR given rectally, vaginal suppositories, edibles? What type of food are they using? Is it gummies? Are they drinks? What's the packaging? Is the content known? Potency, potency, potency. It's all about that with regards to that. And then how often did they take it and how much did they take it? And when was the last time they took it? All these things are important when patients are consuming any of these products. Also, for all of you to know, to please make sure that if you are taking any medication, to always share it with your prescriber, your physician, nurse practitioner, physician assistant, and your pharmacist. Are you taking any prescription medication, any over-the-counter medication, vitamins, minerals, supplements, herbs, probiotics, natural products, marijuana, cannabis, THC and CBD, other things like Prevagen? Do you engage in using nutritional powders or shakes, Ensure, those kind of things, protein supplements, creatine supplements, acute or short-term meds? You just started antibiotic, you just started antifungal, you're taking non-steroidals acutely now because you injured your back last week and you're taking ibuprofen. eye drops or ear drops, creams, ointments, lotions, all those things to consider, and let us know everything you're taking with regards to that. For all those medications, know or at least have available, what's the medication name? The strength, I'm taking 25. What's the unit of measure? Is it 25 milligrams or 25 micrograms? What's your regimen? TID, do you take it 3 times a day or every 8 hours scheduled and spaced out 8 hours between those doses? What's your times administration? Do you take it daily in the morning at 6 o'clock when you first wake up or 9 o'clock after you've already had breakfast? You take it twice a day or do you take it 12 hours apart? An example is levothyroxine for someone who's had their thyroid taken out for 25 micrograms daily at 6:30 in the morning, and I've been taking that since January 30th of 2023. Do they have hypothyroidism? Or are they taking it for some other reason? What's your route of administration? Do you take it orally, PO, subcutaneously, sub-Q, intramuscular, rectally, PR, vaginally, topical? OU is the eyes, AU is the ears. Have a list with this information, have multiple copies, know how current it is, and any changes and the treatment dates that those things change when you did so. So always check and verify. Even after checking drugs.com, check with your friendly neighborhood pharmacist. As Dale told you, I'm a pretty friendly kind of guy. Check with your physician, nurse practitioner, or physician assistant, and especially when starting or changing any new medication or supplement is definitely a time to check for those drug interactions. If you'd like more information, which we'll hear about all day yesterday and more today, you can go to the International Academy on the Science and Impact of Cannabis, ISAC, and you can also go to the nmi.org website. And the truth about marijuana unknown and hidden drug interactions is we've exposed those drug interactions and how dangerous and deadly they can be. So thank you for your time. I'm actually going to turn it back over to Dale to hopefully answer some of your questions. And then also that's my contact information. If you'd like to reach out to me to ask your friendly neighborhood pharmacist, the first one is my work email and the second one is my personal email, but I look forward to answering any questions you have at this time. So back over to Dale, and thank you everyone for your attention, and hope that you found this information to be valuable with some helpful hints on how to address some of these issues. So thank you again for the invitation to present today.
Bill, you don't ever disappoint. You don't ever disappoint. And not only did I see you not look at a note once, I actually heard you take 2 or 3 breaths during the last hour. So good for you. Hey, quick question for you. And I've got a couple that folks have sent in. So we talked about 96 and 61 interactions with classes of drugs, right? Give me an estimate. How many actual prescription drugs by brand name do you think that actually entails when we talk about THC for 96 and CBD for 61 classes of drugs?
My guess would be anywhere from 500 to 750 different medications.
So really, this is a case of caveat emptor when the consumer uses this and is also taking prescription medication.
Buyer beware. And the other thing that's really important about this too, Dale, is the fact that 1, there's always new medications coming out. So that number is going to increase. And number 2, there's additional studies being done with existing medication that all of a sudden, because it now becomes either a medication becomes very popular to take, or as in marijuana, popular to being used, all of a sudden they start doing those kind of studies. So that's a perfect example from the Epidiolex package insert that states, just because we know about CBD interaction with valproic acid and the liver function test abnormalities, we don't know what's going to happen with drugs that actually affect the liver significantly and CBD from Epidiolex package insert. And they caution about that if you do take a medication that may have issues with the liver already that are known, even though we haven't done the drug interaction specifically with CBD and Epidiolex, that could be a problem. So they even raised a red flag about the potential being there, because even though it hasn't been studied yet, that potential does significantly exist.
Now, what about Ozempic? Because we hear a lot now how Ozempic is being diverted away from its intended use and is being used a lot for the weight loss benefits on it.
Well, the one with that is I'd have to look it up specifically, but Trulicity, which is similar to that, not exactly, that one, at least when it came up in the chart that we did look at with our students, Trulicity did not have that interaction. I'd have to go back and look up for you specifically Ozempic. And then once again, you would look up Ozempic with regards to CBD interaction, THC interaction, and then the combination, because once again, the issue is the medication may interact only with one of those components or both. And then even if it interacts with both, that could be a synergistic side effect, or it could be 2 separate types of side effects that could occur from a THC or CBD component. So off the top of my head, I wouldn't be able to tell you what the interactions with Ozempic, but if I got that in the hospital because somebody came in taking CBD or was on marijuana and they're diabetic, and the question be is, oh, their blood sugar is really elevated. Are they really taking their Ozempic? Are they not taking their Ozempic? And now we look it up and there's an interaction with it that could actually make that situation worse. So the one at least was flagged, though, is just the pioglitazone that did have the component there for liver function issues. And that's a concern because that class of drugs has demonstrated that before, which is Actos. That's the brand name.
Okay, this is a question from Marcella. This is a pretty good one. Can you please speak to the interaction between THC and alcohol? THC showing alcohol absorption, alcohol increasing THC absorption, combined effects, that type of thing.
So there's no doubt that CNS depression and somnolence and those kind of things, and that's actually carcinogen in the Epidiolex package insert, so great resource to find that. Alcohol, no doubt, is going to suppress things with regards to breathing. It's going to suppress somnolence, going to make you more sleepy. It's going to potentially decrease your respiratory rate, especially if it's the blood concentrations that we know cause problems. THC and marijuana obviously also do that as well. And now we have a synergistic effect. It's important because if people listened yesterday, it's a great analogy that Dr. Letitia Bader made, where, it's just an additive effect where 1 + 1 is 2, whereas actually 1 + 1 is 11. And
Right.
that's a big concern. And the issue I will tell people with that is with regards to two factors with that. One is the amount of marijuana consumed regarding its potency. So obviously the potency much greater, you're going to have a greater chance for the somnolence and those kind of side effects in the interaction with alcohol. And the other one was with the alcohol, which she mentioned even in her talk yesterday. If you're consuming absolute, is very different than a glass of wine. And so now the question is not only the amount of alcohol proof content they came in with, but how much do they consume and what's their blood alcohol level, which we see significant number of people coming with blood alcohol levels, 300s, 400s, 500s. It's amazing what they're coming with now post-pandemic. And now if marijuana is on board as well, they can have significant somnolence and dose-induced. And now the big wild card there is before with the kinetics and alcohol, where I could calculate, they're going to be in our emergency room 4, 5, 6, 7, 8 hours based on what the blood alcohol concentration came back on that patient. The wild card there is I don't know how long it's going to take them to consume their THC component of that, how much did they take? And now that protracted overdose of alcohol THC combined could be pretty significant.
Quick follow-up question. Lexicomp, is it only available to pharmacists, medical professionals?
Yes, although I think you can reach out to Lexicomp, or Micromedics is another one that's actually used currently in the hospital setting. We have used both. You can actually reach out to them and see if you can get it. I don't know what their position is as far as making it available to the public. But the other thing with regards to that's because it's important that even if you do see a red flag there, to check it with regards to a healthcare professional to be able to interpret the information that's thrown out there with regards to using it, because it may not be necessarily a reason to stop something. And that's where we have to weigh this all the time in the hospital, the risk benefit ratio. I talked about it with a 22-year-old who came in with his albuterol inhaler and his THC, and he's an AFib. Diltiazem may make him tachycardic. Well, diltiazem was working to control his atrial fibrillation, and that was more important to him at 22 years of age, not having a stroke, than it was like a knockdown his heart rate in the hospital. And we maybe tell you that, yes, there may be an interaction, but your healthcare professional has decided this is the best medication for you, even there's an interaction, and now we can maybe adjust that with the dose to actually make it safer. So I don't know what their position is on making Micromedics or Lexicomp available to the public. But like I said, even if you find something in drugs.com, which is available to the public, is to check with a healthcare professional to make sure about the drug interaction you may have detected or even not detected in drugs.com or one of the other databases.
When in doubt, ask and share, right?
And in doubt, ask your friendly neighborhood pharmacist. That's our world. So
in the last couple of minutes I've got one for you. This is from Bill, prevention specialist. He says, has the cannabis industry seen the information you just presented?
Has the cannabis industry seen my information? I don't know if they've seen my information. I don't know if they have access to Lexicomp or Micromedics as well, but I will tell you that what's most disturbing, as Dale knows this because we've had our interns engage this project over the last 2 years, the amount of drug interactions that were found by our students and myself and on our other pharmacists working on this project is staggering. About 1, how many there are, 2, how significant they are, and 3, how some of them are actually deadly. And that's the concern. So I can't stress enough that all the things I list for the helpful hints at the end of the presentation, if you're on anything, and I mean anything, you have to make sure you tell us. A perfect example, just to end with this, is a individual we knew who's a swimmer. He swims well in high school, and he had to take Sporanox, which is antifungal, for his toenail fungus. He then, unfortunately, during the summer, rolled his ankle significantly, as in breaking it, and had to have it pinned, and goes on oxycodone to treat the pain for his fractured ankle. There's a major interaction between Sporanox and oxycodone, and they had difficulty waking him up at home. That's what we're talking about. As simple as just an antifungal for my toenail fungus, and the fact that I rolled my ankle and broke it, and I need oxycodone management until I see the orthopedic surgeon mark, there's pins in it. there's a major drug interaction. And that happens all the time. I can't say the number of people who come into our hospital who have all kinds of underlying diseases and complications and things going on with them that are only confounded by drug interactions, and most importantly, drug interactions now with the liberal use of CBD, THC, marijuana, or cannabis.
Excellent job, Bill. You're a great guy. Appreciate what you're doing.